Hello, everybody. Welcome back to Medical Myths, the show about what not to do with your body. And today we're talking about a myth that has been plaguing the medical community for years now, even decades now. And this is going to be a fun one. We're talking about heavy metal toxicity, and we're primarily going to focus on mercury today because there are a thousand different rabbit holes we can go down with this path. But I think the most pervasive myth related to heavy metals is mercury, especially regarding dental amalgams and vaccines. We won't really get into vaccines today. That's kind of not the intention of this stream because that will be a separate lecture entirely. So today, focusing mostly on dental exposure and some other dietary sources of exposure. But there's a lot of pseudoscience related to mercury, and it's understandable why the public might be scared of this. We've been told since the 1980s that mercury is a problem. Many people understand that certain heavy metals have toxic levels. We understand that if you live in an old house with lead paint, that you can get very sick. We know that consuming dangerous amounts of arsenic is problematic. We know that there are a lot of toxins in our environment that we are exposed to. And the thing is, there's been this blurring of the lines between what is known to be toxic at low levels and what is known, not actually known to be toxic, but people are claiming to be toxins. And that blurring of the lines has allowed for pseudoscientific speakers. I don't want to call them experts because they're not experts, but pseudoscientists have capitalized on this blurring of the terminology in order to further their agendas and to primarily get money. And this is a very dangerous thing. So how did mercury become this kind of villain? Like, how has mercury become this terrible idea within the medical community? How did we even get here? So in the 1980s, a dentist by the name of Hal Huggins from Colorado Springs had written a book in 1985 called It's All in Your Head, which talks about theories of balancing body chemistry and saying that amalgam fillings were the cause of a lot of health problems. They related this to leukemia, to Hodgkin lymphoma, bowel disorders, and other diseases, and saying that these are all caused by the mercury in your amalgams. And if you go to YouTube, you go to many other sites, and you look up mercury toxicity, you can find videos perpetuated by primarily anti-vax people showing the exposure of neurons to mercury. In fact, I have some very anti-vax family members who have tried to show me a video of neurons that they just dumped some mercury on and said, look, when someone puts mercury on these neurons, they shrivel up and burn away. And like, yeah, that sounds very scary if you don't understand what happened, but a lot of the rhetoric used is greatly exaggerated and out of context. And we know that while these compounds are toxic, we do know that mercury in even small amounts can be toxic. But the amount that we're using in things like dental amalgams, the amount that we're using in certain vaccines is so minimal to compare and to say that any amount of mercury is going to be problematic is disingenuous. So they are clearly conflating small, minuscule, acceptable amounts to these larger amounts that we see in those videos. And then they're able to Trojan horse in a lot of their anti-vax ideas. But this isn't the only reason why it's a problem. There are people who capitalize on this anti-vax rhetoric to prescribe chelation therapy that they should not be doing. Um, I don't think that naturopaths, homeopaths, holistic practitioners, etc. I do not think that they should be licensed. Period. I think that they're all dangerous to society, but I especially do not think that they should be licensed to prescribe chelation therapy. And we'll get into why this is so problematic. But this isn't just benign fear of a known toxin. This extends beyond our clear understanding of what mercury is, what lead is, what cadmium is, etc. And it takes this knowledge into whole other levels. And I think, like, when we're talking about pseudoscience, like, this particular area is heavy on the pseudo. It's easy to look at certain pseudoscientific ideas and say, yeah, this is obviously not true. Even things like uh, green tea detoxes. It's easier to say, I can clearly tell that this is not true. But when these people capitalize on something that's known to be harmful and then exaggerate the claims, equivocate contexts that are not related, it's easy for them to pass themselves off as experts. And then something else that they do is they set up these organizations, these pseudo legitimate medical colleges, saying that they are board certified in whatever they practice. So there is actually, well, not anymore because it got disbanded, I think, in 2013. But there was a fake board, and I can show you all this particular thing, which is pretty scary. So it's article from Quackwatch from a year ago, talking about this fake board called the American Board of Clinical Metal Toxicology, which sounds very similar to the legitimate board of medical toxicology. There is something called the American College of Medical Toxicology, the ACMT, which is a legitimate medical college of the American College of Emergency Medicine. So you have legitimate emergency medicine doctors that get a fellowship and are board certified in medical toxicology, which is a legitimate field. But we have here this organization, the American Board of Clinical Metal Toxicology, which sounds very similar, and it is not regulated by the American College of Emergency Physicians. It is not at all related, although they do claim that they require a doctor that is a DO or an MD and is licensed to practice. So they're at least the one thing they have going for them is the people actually are licensed to take responsibility for whatever they're doing to people. But these people, basically, all they do is advocate for intravenous chelation therapy in people who they claim have heavy metal toxicity, which isn't really backed up. And this in here talks about the underlying premises of chelation therapy, and we'll talk more about that. But a lot of these leaders of the ABCMT already have legal problems elsewhere, so a lot of them are not really concerned about legitimacy. So 6 of them listed here have had other fraud-related charges or assault charges. So you can tell that they don't really care too much about legitimacy. But I want to show you some of the testimonials that people have related to particularly holistic dentistry or biological dentistry, which is an interesting label. Because if you are a licensed dentist and you practice a legitimate field of dentistry, you don't need to make up these other meaningless certifications in order to seem credible. If somebody says, I'm a dentist, I can perform dentistry, I'm licensed to be a dentist in this country, in this state, that's plenty legitimate. And all dentistry should be biological dentistry. Like, to add these extra unnecessary labels to say, well, my dentistry focuses on the biology of a human. Well, great. All dentistry does that. Like, I may be wrong. I'm not a dentist. I'm almost a physician, but my understanding is that teeth are part of the body and they are part of biology. Like, biology regulates how teeth work in the human body. So to say that certain dentists are biological dentists because they oppose mercury fillings is a bit ridiculous. But it convinces the public that they are more biologically sound than these other dentists. And it's absolutely ridiculous, the labels that people will accept to promote their ideas. But there is a dental office. I pulled up some testimonials. And this whole dentistry office, their motto is connecting dentistry with wellness, which, like, yeah, all dentists should be concerned about wellness. But I mean, the way people have been kind of unable to define what wellness means is a bit concerning. But these are just testimonials from people. So we have one person saying, I have had numerous positive results since taking the action of having my amalgams removed by Dr. Lawrence Bennett almost 2 years ago. I no longer suffer from nearly as much gastrointestinal distress. So this person says that removing their amalgams treated their gastrointestinal issues, and that they used to suffer from asthma, and now they have fewer asthma attacks and fewer migraines. All right, we need some evidence to support these claims. We also have somebody who says that they've been having neck and jaw pain for many years, and they'd been working with a chiropractor and would get short-term relief, but the pain would always return. And then, this actually is kind of okay because this particularly isn't talking about their amalgams. It's just talking about they got dental work and they had less jaw pain, which is reasonable. I think that's okay because you can have jaw pain from having your teeth not well aligned. So I'll give them that. Yeah, stop seeing a chiropractor, go see a dentist because your jaw problems might be causing that. I don't have too much a problem with that. He did a wow. Okay, so this guy saw a doctor, and this was like a holistic doctor that said, "Hey, you have a clean bill of health, but you still have symptoms, so we're gonna send you to a holistic dentist to remove all your fillings." So this is a lot of they don't even explain the symptoms that this person has. Oh, maybe they do. So they have talking about limited joint mobility, headaches, which are very general complaints. Like, so let's take joint mobility. How in the world are the mercury fillings related to their joint mobility? Of course, they're claiming that it's the mercury that's causing this. Um, they're claiming that the mercury was affecting them having headaches. But let's think really quick about what can cause headaches and what can cause joint pain. Like, even joint pain is a great one. Let's start with that. What can cause joint pain? Running on concrete can cause joint pain. Sleeping wrong can cause joint pain. Rheumatoid arthritis, osteoarthritis, any sports injury will probably cause joint pain. Gout can cause joint pain. I can think of a lot of differentials to say maybe this is the cause of your joint pain. Um, so I would need more evidence to convince me that it was the mercury in this case that caused that. Headaches. What can cause headache? You can have migraines. You can have cluster headaches, tension headaches. You can have dehydration. You can have inhalation of some kind of irritant that gives you a headache, inhalation of cleaning materials. Like, the differentials go on and on. So these are not very specific symptoms to base a diagnosis off of, especially if we don't have evidence that the mercury is causing this. This is just a few examples of why I'm skeptical about these claims. But we're going to look at some more claims specifically by one of my favorite chiropractors and naturopaths, Dr. and I use that term loosely, Josh Axe of Ancient Nutrition. So he has an article here talking about the dangers of heavy metals and how to do a heavy metal detox. So right off the bat, we have him making the claim that heavy metals are dangerous and that in order to treat this, we need to do a detox, which he is going to teach us and possibly sell us. So he says, symptoms and even chronic diseases related to heavy metal toxicity, also called heavy metal poisoning, is now considered to be a problem that millions of people deal with. Exposure to toxic heavy metals is believed to be a contributing factor, if not a root cause, of symptoms like low energy, mood disturbances, and cognitive changes. All right, again, so detectives in the audience, let's think of some differentials for low energy. What things can cause low energy? Well, apparently we have a differential of heavy metals. All right, I'll give that to you. Lead poisoning probably could cause some low energy. What else could? Sleep apnea could cause low energy. Sleep disorders, narcolepsy, iron deficiency, anemia. Um, pretty much any viral illness. A lot of bacterial illnesses can cause low energy, dehydration. The list keeps going. What can cause mood disturbances? Stress, being just grumpy that day. Hormonal influences such as high or low testosterone levels. What can cause cognitive changes? Stress, having a bad day, UTI. There are countless differentials here for these very non-specific symptoms, but he's going to chalk them all up to heavy metals. And so he goes on to say heavy metals first enter your bloodstream from exposure to farmed fish, contaminated water, dental fillings, and household products. These metals then travel throughout your body and penetrate the cells of various tissues and organs where they can remain stored up for years. So this sounds very dangerous. Like if somebody says, well, mercury can lead to cognitive symptoms. It can cause Mad Hatter syndrome, like we used to see a long time ago with mercury exposure to hat makers. It can cause seizures. It can cause coma. That sounds very dangerous. But I have some questions. So what is the dosage required to harm somebody? Yeah, and HR has a great point here. Thyroid is another huge differential for low energy, mood disturbances, and cognitive changes. And we could test for that. A chiropractor's probably not going to test for thyroid issues. And if they are, I have questions because they should not be doing those tests to begin with. But what dosage and what would cause somebody to get mercury toxicity? So let's look at mercury, and also let's look at how these people scam the public into these kinds of ideas, and not just Josh Axe, but many other people. There are some specific techniques that they utilize to get you to buy into this rhetoric. So let's look at this is a paper. I have to scroll up because I wasn't at the top. A paper from the Annals of Occupational and Environmental Medicine. So this is called Evaluation of Mercury Exposure Level, Clinical Diagnosis, and Treatment for Mercury Intoxication. So their abstract, they talk about mercury occurs in various chemical forms, and it is different to health effects according to chemical forms. So it goes into talks about elemental mercury, and then also talks about organic sources of mercury, such as ethyl and methyl mercury, and the differences in the toxicity and how you would go about diagnosing toxicity with these different types of mercury, different routes of exposure, and different levels of exposure. So there's a section here. I don't know if here. So, talking about inorganic mercury is mainly absorbed through the respiratory tract, yet to a small extent is also absorbed through the skin or GI tract. However, unlike metallic mercury, inorganic mercury cannot penetrate the blood brain barrier and commonly ends up building up in the kidney. The main excretory pathways include urine and feces, with about 2 months of half life. Um, the main yes so integrate I cannot speak today. I don't know why my speech is like not working. Maybe it's the mercury, and I don't even have mercury fillings, but obviously mercury is getting into my house through somebody else's. I bet somebody else who had mercury fillings was in my house, and then that's why I'm getting toxicity. Just kidding. Don't go off of that. Inorganic mercury discharged to the natural environment flows into the sea, river, or stream. In the water, it converts to metallic mercury by bacteria and plankton. Then it accumulates in the body of aquatic organisms, including fish and shellfish. Finally, when humans eat seafood, the mercury enters the human body in the form of metallic mercury. Methylmercury, a major type of organic mercury found in the form of monomethylmercury and dimethylmercury. Methylmercury is easily absorbed into the GI tract and into the respiratory tract. About 90% of methylmercury is excreted into the feces via bile and less than 10% in the urine. So this is a very important point. I want you to remember this here. That 90% of methylmercury is excreted into the feces and less than 10% goes into the urine. And it has a half-life from 45 to 70 days. And they talk about the pathways of exposure include ingestion of food, inhalation or absorption via skin of mercury vapor at work sites, exposure during the processing of industrial and household waste, use of pharmaceutical drugs or cosmetics. And the interesting thing, so we all, through this kind of low level environmental exposure, we have mercury in our body. All of us have exposure to mercury. And the question is, how much is too much? And so they're saying here that the average mercury concentration levels in the general public in whole blood and urine were observed to be 1 to 8 micrograms per liter and in the whole blood, and then 4 to 5 micrograms per liter in urine. And then people that did not eat fish had a lower level of 2 micrograms per liter, suggesting that there may be higher levels in fish, which we do know is the case due to pollution. But the amount needed to cause toxicity is a lot higher than this kind of baseline level. And depending on the population exposed to this, we do see lower levels of exposure causing toxicity in children. So if you gave straight up mercury to a child, and they got symptomatic, yet they'd have a lower amount that they'd need to reach toxic doses than an adult. An adult, you see death maybe around 100 micrograms per liter. You can see toxicity. I think the number I had found was around 35. You can really start seeing some neurologic problems. But this is much higher than this baseline level that we're seeing here. But how can people? So let's think, if I'm going to be a grifter and I want to sell people on my detoxes and I want to tell people that mercury is problematic, I need to convince them that they have a problem. And it's really easy, unfortunately, to do this because as everybody has a baseline level of mercury, I could do a test and I could test people for mercury and I could tell them, look at this number. You have mercury in your body and we need to get it out. So there's a type of test that is utilized by these alternative medicine practitioners called the provoked testing for heavy metals. And they do this for a lot of different heavy metals. And it's usually non-specific, which is kind of scary, because so they'll do a test, and how this test works, the difference between a provoked test and an unprovoked test is the unprovoked test, they just take a blood sample or a urine sample, and they just measure the raw amount of heavy metal in that sample and tell you, whether that, meets the average threshold or not. But what you could also do, if you're these people, you could do a provoke test where you give a chelation agent that is going to promote the excretion of heavy metals. And then that's going to make their level in the urine higher than it would be at baseline. Because, as we know, mercury accumulates in fat tissue and in other body tissue, and it can be slowly released over time, and the amount that it's being stored or released is not been shown to be clinically significant. You don't really see symptomatic differences in people with these varying levels at baseline, but you can get more of these compounds released at the same time, get a higher level in the urine, and they can say, wow, your average is higher than normal for what your baseline should be. And this is kind of a misleading test. Yeah, why are chiropractors doing heavy metal tests at all? They should not be. They should not be. But they will join these organizations, like I mentioned, with these pseudo legitimate American Board of Clinical Metal Toxicology or something, and then claim that they can do this. Uh, but it's very scary that they think they have any qualifications at all to promote this. I'm going to pull up another Quack Watch article about this provoked testing. So the American College of Medical Toxicology, the legitimate organization, had said that this testing is illegitimate. It has no demonstrated benefit and is harmful because it tells people that they have toxicity when they don't actually. Um, so chelation claimed that there's a body burden that can be estimated by comparing a patient's urine levels before and after provocation, and that the temporary rise in urine levels represents removal of hidden body stores of the ions. And they hear in this article, who's the person that wrote this? Dr. Baratz is the person who wrote this in 2016. Gives a really good analogy about why this is problematic. So they say, imagine a classroom with 60 seats and one student in each seat. So let's say you're watching this from the hallway. So you have a set number of students in the classroom. You've got 60 students, and you're out there in the hallway. And every minute, one student gets up from their chair and they leave and go into the hallway. So if you don't know at all how many people are in the room, you could maybe try to estimate how many people are in the room based on how many people leave per minute. That is, if you can assume that the rate of leaving the room is consistent. So it says if one person goes into the hallway each minute, the room will empty at 1 hour. But let's say you increase this rate to 2 students per minute. The room is now going to be empty in a half hour because you know that you have the same 60 students and they're just leaving at a faster rate. But these people, essentially what they're claiming is that there's some unknown number of students in the classroom. And if one student leaves, we can assume one number of students in the classroom. But then if 2 students now leave at the same time, that must mean that there's more students in the classroom to begin with. And that's not true. You cannot make that claim. You cannot draw that conclusion from this data. But that's essentially what they're saying with the chelation argument, that um, because if you have a baseline level of mercury in your body, that number, that level in your body is not changing because you did the provocation test. All that's changing is the rate of excretion. So you can make somebody think that they have more mercury in their body than they actually do. And also, a problem with this, like we just noticed in the previous article we looked at, was this is a urine test. Most of the most of any excess mercury is going to be removed via feces. So it's interesting that they don't choose a fecal test for this. But if you think about it, if if I tested the urine and then it was average or around normal, but the patient didn't know that, I can say, well, your levels are you have levels in your urine, and not knowing that, like, if they had excess in their feces, that might confirm that they had a higher level than normal. But it leaves it ambiguous. It leaves you without the answer to how much is in their fecal excretion. So they could just claim, well, it possibly could be abnormal, but they don't actually have to test it. And so you're just left with that question. You don't have to verify it, which is kind of sketchy as well. Um, but see how easy it is to convince somebody that their mercury level is higher than normal. But also, we have other heavy metals in our body all the time. We have copper, and we need copper. We utilize copper. We have iron. We have some cadmium. We use these as cofactors for a lot of metabolic processes. So these provocation tests, oftentimes they just tell you you have X amount of heavy metals, but they don't differentiate which heavy metals are present and what the amount is of each of these. So if you add up all of the baseline levels of iron, copper, mercury, etc., of metals that we have baseline in our bodies, add them together, you can get a higher number than if you individually factored for mercury levels that are in this 4 to 8 microgram per liter amount, which is known to be baseline. So it's very easy to convince somebody that they have a problem. And so now that we know that people don't actually have a problem, um, we're going to talk a little bit about this chelation that people suggest that you do. Or, we might get into chelation in a sec, because uh, Josh Axe does fall in line with the weird chelation ideas, but I'll let him get there, I think, before we jump straight into that. So he claims here that foods can help you remove these heavy metal toxins, including leafy green veggies and other non-starchy veggies, herbs, spices, algae, superfoods, and bone broth. So here we go. He claims that the dangers of heavy metals, aka heavy metal poisoning, where's his here? The symptoms, he claims: chronic fatigue, autoimmune diseases, including Lyme disease, which is hilarious that he thinks that, because I didn't notice this ahead of time. Like, because I know people claim mercury causing autoimmune disease, and there is some legitimacy to that. But Lyme disease is caused by a microorganism. It's caused by Borrelia, which is, I mean, a lot of people here would know that this is related to tick exposure. But the fact that he's claiming that Lyme disease is caused by heavy metal toxicity is incredibly laughable to me. Poor recovery from exercise and weakness. Define for me, Dr. Axe. Define for me what is poor recovery. Are we talking? I get that poor exercise recovery, or exercise intolerance can be a subjective symptom of things like heart disease, venous collapse, venous stasis, certain muscle disorders could have this symptom of poor recovery. But like, you could have somebody that's just out of shape that thinks that they're having poor recovery from exercise when really they're just not in shape, or they're trying a new exercise that they've never done before, which could cause them to think that they have poor recovery. Skin irritation. I can think of 1,000 differentials for skin irritation. Neurological disorders, just broad brush neurological disorders, brain fog, trouble concentrating, difficulty learning, and poor memory, dementia, depression, bipolar disorder, and or anxiety, which is a very dangerous claim to make, because now you're getting people who are vulnerable, who can't get in to see a mental health professional, that are now going to say, give me chelation drugs to treat my depression. They're claiming IBS, which is very not well understood anyway. So they can claim that they have the solution to IBS, but these allopathic doctors don't. Chronic pain, tremors, impaired hearing, higher risk for heart attacks, etc. And some of these, are true. You can get some of these symptoms from very high levels of mercury exposure. We know that you can get neurological disorders from very high levels of mercury exposure, but that's not going to happen from baseline. They're taking somebody who doesn't know the cause of their symptoms, saying, look, I found a pattern. Some people who have had mercury toxicity also had these symptoms. Therefore, if you have these symptoms, you probably have this heavy metal toxicity. So we have a post hoc ergo propter hoc reasoning here that is dangerous. You are ignoring other differentials, and you are convincing people to not get adequate health care from a qualified professional. And this is incredibly, incredibly dangerous. And he straight up claims heavy metal amalgam dental fillings. He claims tattoos cause this. He claims toothpaste, canned food, plastic toys, and possibly receiving certain vaccinations. So doesn't explicitly come out saying he's anti-vax, but he tries to sound conservative so that you don't yell at him, essentially. But he is posing the claim that vaccines cause this, and says in high amounts, mercury is one of the deadliest metals there is. Certain studies have found that when nerves are exposed to mercury, the myelin sheath can become severely damaged, interfering with how nerves communicate. And I talked about this at the beginning of the episode. I saw the video of this. And yeah, if you take a high amount, higher than the baseline dose, higher than the recommended safe dose of mercury, and you plop it straight on an axon, yeah, you get this as a problem. But that's not at all what we see happening here with fillings and with vaccines. Can you die from heavy metal poisoning? Yeah, you can die from a legitimate poisoning if you live in a house with lead paint. You can die from lead poisoning. This is true. If you eat lead paint, you can die. We're not denying that. I'm not at all denying that. But they are equating this baseline level to the toxic dose, and that's where it's problematic. And he is promoting a heavy metal detox. He says you should speak with your doctor or integrative practitioner or naturopath. Do not talk to, if you think you have a legitimate lead poisoning or mercury poisoning, if you suddenly have a change in mental status to where you're having seizures, and you didn't have seizures before, the last person you should talk to is a naturopath. Like, you need probably an emergency room if it's happening right now. If it's something that has resolved previously, but you had that exposure, maybe you can get away with an outpatient visit. But no matter what, you should be talking to a qualified healthcare professional that can treat this. And if you go to the emergency department for an acute lead poisoning, you're probably going to be talking to a toxicologist, a legitimate toxicologist from an actual board of toxicologists, not from this fake organization. And you should not be doing the liver cleanse My God, do not do a liver cleanse for this. You need help. And he says here, well, he talks about the detox diet of vitamin C, leafy green veggies, herbs and spices, water, flax and chia seeds, bone broth, and garlic and onions. If you're having a seizure, if you have rapid onset dementia, do not just sit at home and think, yeah, I'm going to drink some orange juice and eat a whole head of garlic. Like, don't do that. Go to a hospital. This is dangerous. But of course, he's not targeting people that are acutely experiencing seizures. He's targeting people that think, oh, well, I had a headache last week. I wonder if I have mercury poisoning. And that's the logic we're at here. Don't do this. It's not going to help you. I mean, well, if you have headaches from dehydration, water might help you with your dehydration. Leafy green veggies. You know, if you've gone like a month without eating a single vegetable, you're probably deficient in some vitamins, and you should eat some veggies, and you should probably eat some fruit. That's a legitimate thing that you can do. But otherwise, this is a dangerous claim. And he keeps posing all these other things that you should do. But here we go, 4 treatment methods, and right off the bat, he is advocating for chelation therapy. So we're going to talk a little bit about chelation. Biddy Buddha is here. Hi, welcome to the chat. Do a video on cooking with Teflon. I can do that later on. That's definitely a good topic. And Grimbeard wants an episode on exercise recovery and compression boots. I should do that. That sounds very interesting. We also have Fair in here. A lot of people have joined since I started. But we're going to get into chelation. And this is kind of the scary part of the episode for what these naturopaths are doing about this proposed heavy metal toxicity. So they've already convinced you by this point that you have a heavy metal toxicity and you need to do something about it, such as a chelation therapy. So let me talk right off the bat about legitimate chelation therapy, because there are definitely times to use chelation. And so this article comes from Poison Control, the National Capital Poison Control. I'm not quite sure which country this is from. This might be Canadian, it might be American, I don't know. But they're talking about chelation therapy, legitimate chelation versus chelation therapy. And they say chelation therapy is a treatment for heavy metal poisoning, iron, mercury, arsenic, and lead. Some people give chelation therapy for other conditions such as cardiovascular disease, autism, and Alzheimer's. This exposes patients to risk without benefit. A large study in chelation therapy for cardiovascular disease leads some researchers to suggest further study. And we are going to talk about that study here, and we're going to get into a very dangerous claim that ended up in a lawsuit. There's a lawsuit from a wrongful death caused by a naturopath who used chelation to treat somebody's chest pain, which is super, super scary. So chelators are legitimate. If somebody has high exposure to lead, if you are in that house with lead paint, or you're a child that ate some lead paint, and you go to the hospital, you might be given one of these chelation agents. And what this does, it's going to bind to the metal in question and make it less likely to accumulate in the body and make it easier to excrete it. So some agents we have here are Suxamer, used for treating lead poisoning primarily, can also treat mercury and arsenic. Not a whole lot of side effects you get with Suxamer. Dimercaprol is an injection to treat severe lead poisoning, often in conjunction with EDTA. Can be used for mercury poisoning and arsenic poisoning. And this one isn't used as frequently because of the high amount of side effects, with high doses causing coma and seizures. We have EDTA given IV as well for lead poisoning. which is nephrotoxic. So you have to be very careful with this one with someone with kidney disease, or if you have any concern that they could develop kidney disease, you need to watch out for that with EDTA. Deferoxamine is used for iron. I think this is one of the more favorites. At least it's a favorite on the medical boards for iron poisoning. That can cause, as they're saying, low blood pressure, lung injury, and infections. Penicillamine is another favorite of the medical boards, treating bismuth, copper toxicity, lead, mercury, and nickel toxicity, primarily for acute poisoning, but you can have people with allergic reactions. So here's the thing. When we are chelating somebody, if we have somebody in the hospital for heavy metal toxicity, they are in bad shape, very bad shape. And we have to weigh out the risks and benefits of chelating. Is there toxicity to a point where we need to risk hurting them in order to get the substance out? Because these chelation drugs, as we're seeing here, are not very pleasant, and they have some pretty significant side effects. And yeah, these are dose dependent. So a lot of people might not have these side effects, but many people do. And so you have to weigh out, am I willing to put my patient through the risk of coma and seizures with dimercaprol, or is it not worth that risk? And do we think that they can survive without long-term deficit by managing this in a more conservative fashion? And that's what you have to weigh out. So in no way are we claiming that these drugs are perfect. They are very risky. But strangely enough, the community that often advocates for alternative therapies and people that oppose conventional therapy, one of their primary arguments for, say, the COVID vaccine, or even for statins now is a big one people have issues with. One of the biggest arguments is that look at all of these side effects from these other drugs. Why would you want to take medication with this list of side effects when you can do this natural therapy? But strangely enough, you don't see that rhetoric done for chelation drugs. And I wonder, it seems like they're using that because they are prescribing the chelation drugs. So of course, like, their dishonest argument against the pharmaceutical industry in general, and I'm not saying that the pharmaceutical industry is perfect by any means, but like their argument against conventional medicine, they don't apply that same logic to their own therapies, which are pharmaceuticals. Like the times when they are allowed to use pharmaceuticals, they don't apply that argument because that would convince people to not do their treatment. So it's interesting, the double standard here. But these are very, very risky drugs. So, and the first study that they quote is from the National Center for Health Statistics, reported that 111,000 adults said that they used chelation therapy, along with 72,000 children under the age of 18. And it's highly unlikely that 183,000 US residents required chelation therapy for a limited number of approved indications. So they're saying this study basically showed that a lot of people that do not need chelation got chelation. So these drugs with kind of serious side effects were used unnecessarily, and that it's much more likely that these therapies were received for conditions attributed to heavy metals without scientific validation. So any of these minor symptoms that we saw, low energy, memory issues, exercise intolerance, etc., might have been reasons why these people got unnecessary chelation. The FDA warned several companies that marketed chelation products and tests for home use that they are violating federal law. These products purported to treat conditions such as autism spectrum disorder, cardiovascular diseases, Parkinson's disease, Alzheimer's, macular degeneration, which is wild. Chelation therapy has been associated with fatalities. A 2-year-old girl with lead poisoning died after the wrong chelation drug caused her blood calcium to drop too low. A 5-year-old boy with autism died after being inappropriately treated at a doctor's office with a chelating drug. Yeah, because autism is not caused by heavy metals and is not an indication for a chelation. A 53-year-old woman without heavy metal poisoning died during chelation therapy by a naturopath. So we're seeing significant problems. And they're going to talk more about mercury and lead poisoning and all these. So they say, do I even want to? We can read this whole thing. That's fine. I don't think that it'll go too far. Chelation therapy is offered for a number of conditions: arteriosclerosis, angina, poor circulation to the legs and feet, autism, etc. We talked about that. To diagnose heavy metal poisoning as a cause of some of these conditions and therefore appropriate for chelation therapy, practitioners will often administer a test or challenge dose of a chelator. So just like I was talking about the provocation tests, in a day or two, a urine test is done to measure metals. Since some metals are found in all humans, these tests are always positive, though they are not measured against established or medically accepted standards. So you get that positive test, and then people give you the chelation drug. So how do they propose that this works for atherosclerosis? This is actually pretty hilarious. So the study that suggested this relationship, there's a specific paragraph about the study. Oh, here we go. Okay. Chelation therapy for heart disease was first described in the 1950s. A trial of chelation for intermittent claudication was published in 1994. The authors found chelation to be no better than placebo. Because he found in this kind of meta-analysis, 22 studies and case reports without control group, most reporting symptomatic improvement, but without documentation of improvement. There were 2 case reports with objective measurements of results, neither documented benefit. There were 2 controlled clinical studies, one with 9 patients and one with 16. So very low ends for those. So n equals 9 and n equals 16, which are really not enough to, you're going to take a huge statistical penalty for claiming that there's a significant difference with n equals 9. Neither one documented benefit. The author attributes symptomatic improvement with measurable clinical improvement to a powerful placebo effect. That he states the most striking finding is the almost total lack of convincing evidence for efficacy. So we have studies that laughably, 22 of these studies had no control groups. So they just said, hey, do you feel better after this? And they're like, yeah, I do. Cool. That's our data. That's not enough. That is not enough to justify giving somebody chelation therapy with all of the risks that were mentioned for their atherosclerosis. And here's something scary. I want to read this lawsuit because this is wild. Okay, so this is a wrongful death lawsuit. A Montana jury has awarded 501 roughly thousand to the widow and estate of this guy named John, who died of a heart attack at age 52. So it sounds like the patient, who was a psychologist, had suffered from asthma most of his adult life. After trying standard medical options, he consulted a naturopath, Matthew Schlechten, for treatment. During the visit, the patient mentioned occasional heart pain and a family history of heart disease, which anybody who is a licensed physician or PA, NP, anybody with a valid medical license, and education to treat patients would know that, hey, occasional heart pain and family history of heart disease should tell me that you have maybe at best some stable angina, more than likely unstable angina, and possibly, worst case scenario, myocardial infarction or heart attack. So this person has very high risk for a heart attack. And even if they're not having one right now, they could very well have one in the near future. So this should prompt somebody to, at the very least, if this was stable in the moment, which I don't know how a naturopath would know whether or not somebody's chest pain was stable, at the very least, should have a cardiology referral. At the very least, should be seeing a PCP to get said cardiology referral. More than likely, they should be getting, they should just be going to the emergency department. They should go. They should get an EKG. They should be probably admitted for observation and given a stress test. There are many things that should be done for this person. But this naturopath did not do that. So he did conclude that the pain was caused by angina, which, like, duh, angina. So angina is not a condition itself. It's a symptom. Angina is a condition. We do label it as stable or unstable in terms of what is their likelihood of progressing to a heart attack. And somebody with stable angina is likely not at immediate risk. But saying that the pain was caused by angina is like saying that your chest pain was caused by chest pain. That is what that means. And that is, it does not make me confident in your clinical ability to treat this. But instead of recognizing the seriousness of the symptoms and referring the patient for medical care, he treated him with intravenous EDTA chelation therapy over a 3-month period. So he got these IVs of this chelation therapy, this was the one that caused kidney damage. But he's just like, yeah, no, you don't need to go to the emergency department. We can just give you IVs over 3 months. 8 months after his last visit to Schlechten, the patient died from a massive heart attack. Yeah, because you're at very high risk. The autopsy showed widespread coronary atherosclerosis and blockage of the main artery to the heart as the fatal event. And this is wild to me. So before the trial took place, the Montana Alternative Healthcare Board ruled that Schlechten was negligent in failing to refer the patient, but was not responsible for his death. How in the world? I mean, I get that these are not doctors. This is a board of alternative health, so they probably don't know how to treat chest pain. They don't know how to diagnose stable or unstable angina. They probably don't know how to do a stress test. So yeah, of course, they might not think that this person is responsible. But even so, how would you not hold this practitioner responsible, knowing that this is chest pain? I think the majority of non-doctors, like, I don't think it takes a doctor to say, you have chest pain, you need a workup. Like, it takes a doctor to do the workup, but it doesn't take a doctor to say, hey man, you really should go to the hospital. You have chest pain. I think the majority of the public knows that chest pain is problematic and can kill you. Apparently this guy didn't. And his board initially did not hold him responsible for this wrongful death. So facts common to all accounts. That the patient died on October 15th, 2006 at age 52. The coroner determined that the cause of death was a myocardial infarction. The patient was treated by defendant within the 11 months prior to his death for his asthma condition. The patient's first visit with the defendant was on November 11th, 2005, so he had already been seeing him for a year at that point. During the 2005 visit, defendant noted a history of occasional tightness in the chest, occasional heart pain, family history of heart disease, and defendant's records of that site visit state address angina with chelation. So he knew he was suffering from angina and decided, I'm going to give you this unregulated, unverified therapy for it. Defendant's notes taken during that visit state last night, the patient woke up with angina pretty bad. During November and December 2005, defendant administered intravenous EDTA chelation and chemical detox treatments to the patient several times. Defendant treated the patient 8 times from November 2005 through February 2006. And the autopsy revealed widespread coronary artery atherosclerosis with thrombotic occlusion of the LAD as the fatal event. So, this is pretty bad. And this is absolutely a reason why, this is absolutely horrifying. The fact that this person is allowed to claim that they can treat asthma, first of all, is mind-boggling. How can a naturopath treat asthma? Like, no, stop it. Stop it. You should not be doing that. And how can you think you can manage somebody's chest pain? Like, this all goes into you don't know what you don't know. And the absolute hubris of these naturopaths to say that I know how to treat you despite not going through medical school is astounding. This is Dunning-Kruger at its absolute finest. And it's just wild to me that some states allow them to do this, and that the board said that this person was not entirely responsible. Let's go back to Josh Axe. Here we go. All right. So we kind of skipped through like a lot of this stuff. Heavy metal detox symptoms and how to deal with them. When you begin to detoxify, certain symptoms can be expected as your body starts to acclimate. So they equate the side effects of the detox to just being, it's your body getting worse before it gets better. The pain is a sign that the treatment is working, which is wild again that they're applying that rhetoric to this. But then with a legitimate pharmaceutical, they'd say, no, those side effects mean that it's toxic and bad for you. Again, the double standards. You might temporarily experience, interesting, a lot of the symptoms that they claim are caused by the heavy metal toxicity to begin with. I don't even know how much left I can go into this because it's just a lot of repeating. Like, it's the common diagnostic tactic of these naturopaths to say, hey, do you have non-specific symptoms? Wow, you do? It's probably this other thing. And then the answer is detox. And they apply this to pretty much any condition. Like, they'll relate these symptoms to some non-specific symptoms to a very specific condition, but then for some reason, every single time, the treatment is the same thing. They use the same diet detoxes, like the same juice cleanses, but like, I guess these people do make the claim that all of these very specific conditions are all just related to inflammation, non-specific inflammation, or like non-specific heavy metal toxicity, etc. So they just are very good at making people think that they have conditions that they don't have. And I think I might end up ending the episode here for today. Actually, here we go. No, I do want to mention this because I just glanced at I just glanced at something in the other article about the criteria for when you should be evaluated for impacts of mercury exposure. So a study reviewed that several sets of data, including those of the 2005 U.S. CDC, 2004 U.S. EPA, and 2001 American Conference of Governmental Industrial Hygienists. Wow, I'm just like apparently dying today. They established the normal mercury concentration range to be 4.6 micrograms per liter and 4.0 nanomoles per of mercury per millimole creatinine and below for blood mercury and urine mercury, respectively, which are in the 95th percentile in normal adults. So this is probably kind of like the majority of people are going to have their range between these amounts. The study also suggested the mercury limit for vigilance regarding meaningful exposure sources such as occupational exposure or food ingestion, and for setting reduction measures to be 10 micrograms per liter and 19.8 nanomoles mercury per millimole creatinine. The concentration level which warrants clinical interventions was proposed to be 40.0 micrograms per liter or higher for the blood mercury level. For urine mercury concentration alone, the data was insufficient. Thus, the limit for concentration level to initiate treatment was not suggested. So again, this going back to the people doing the provoked testing, it makes sense now as well why they would use the urine level as opposed to a blood level, because the blood level has very clear definitions for what would warrant chelation therapy in a hospital setting. We're seeing this very high amount of 40 micrograms per liter compared to the baseline level of 4.6 micrograms per liter. That's a huge difference in blood concentration. But if you take the urine level, and conventional science has said that we cannot determine accurately the threshold at which we would treat mercury toxicity with regard to urine concentrations. So since we don't have that defined level, these naturopaths can do that provoke test and say, well, we got this amount in your urine. And since we don't know what the defined level is, any level is high. They can do that here, which then would cause people to buy into their therapies. Another study is saying that interventions needed to be considered for cases in which mercury-related symptoms exist and the blood mercury concentration is 100 micrograms per liter or higher, which is even higher than that 40, as well as asymptomatic cases with 200 micrograms per liter or higher blood mercury concentration. So if you're symptomatic, so this particular study at the end with the higher amounts suggest if you're having symptoms and your blood concentration is 100 micrograms per liter or higher, we need to intervene. Or if you don't have any symptoms, but you have a blood level of 200 micrograms per liter, so double the amount if you're symptomatic, we're going to treat you anyway. And again, they're also mentioning that there's no universal diagnostic criteria for mercury overload, which again could allow for these pseudoscientists to claim that whatever symptoms you're having and whatever level you have is a sign of mercury overload. So some studies are saying that the reference range of 2 standard deviations or higher by provocation tests. Others are saying that you go off of these defined levels. Some studies were saying meaningful toxicity symptoms at 50 microgram per liter or lower. I think the lowest that I saw was 35. So probably this 40 up here is probably the most conservative level, and probably we should go off of that. But still, even the most conservative level for when we should intervene for a mercury toxicity um, is going to be more than this 4.6. And with regard to the mercury in amalgam fillings, and this is a point I didn't mention previously, but there is some risk with inhalation of mercury in the amalgam fillings. You're not really going to be getting exposure from uh, swallowing any of that because it's probably just going to pass right through. It's not well absorbed in that form. But is there inhalation risk? Yeah, a little bit. But the amounts that we see from the dental amalgams is way lower than that 40 microgram per liter amount that would suggest toxicity. I think I had a number for what the actual expected amount was. I might not be able to find it. Oh, another test that they do that's interesting. So sometimes for the mercury fillings test, they won't like or either they won't do the provocation test or they'll do this in addition where they'll have somebody like bite down on this compound that binds the mercury so that they can show you have mercury in your fillings when it's still the baseline level and not any cause for concern. But they have their ways of having a very high sensitivity test and a very low specificity. So I say this a lot. It's capturing a lot of the people who it's capturing a lot of people who don't have an issue. So you're getting a very high false positive rate, but you're not able to narrow down who actually has the condition versus who were the false positives, which can be a big problem. We want to make sure that if we're going to give somebody a medical therapy, especially one with high rates of side effects, that we're giving it to the right people. And there are some important factors that go into what constitutes a good test. And I want to see if I can find this statement for you because I really liked how clearly these criteria were laid out. I'm going to find this. Okay, so this is again from Quackwatch, and I liked the way that they phrased this. So Dr. Barrett wrote this in 2022. 4 things should be considered when evaluating whether a test is useful. Analytic validity. Does the test accurately measure the component of interest? So can we pick up the accurate amount of whatever metal somebody has? Clinical validity. Does the test detect or predict the presence or absence of a recognized clinical disease or predisposition to such disease? Relevant parameters include sensitivity and specificity. So can we use this test to actually predict who has a condition and who doesn't? Ideally, a test is going to be better if we can accurately rule in people who have all of the people who have the disease and accurately at the same time rule out people who don't have the disease. So that matters. Clinical utility. What is the likelihood that using the test will lead to improved outcomes? So if we do a test, what is the likelihood that the management is going to change? Is my plan for the patient going to be any different compared to if we didn't know the exact answer? And for something like this, take a viral infection. Let's say somebody has a common cold. There are probably a few different viruses that can cause a common cold. They're usually very minor. You can get over it on your own, we're not really going to treat your cold except for symptomatic relief, just supportive care. So if I have somebody coming into the clinic with a common cold, is it really worth the time and energy and discomfort to test somebody for what specific virus they have? Probably not, because my treatment's not going to change for them. So that kind of test would have no clinical utility. However, if somebody comes in and they have evidence of pneumonia, and I wanted to test them for COVID, or I wanted to test them for bacterial pneumonia, those tests are then clinically useful because they're going to change my treatment. I'm going to treat somebody with COVID different than I would treat somebody with pneumococcal pneumonia. So that's something that is useful. The test matters. It's going to change the outcome. Ethical, legal, and social implications. These include how the test is promoted, how the reasons for testing are explained to the patient, the incidence of false positive results and incorrect diagnoses, the potential for unnecessary treatment, and the cost effectiveness of testing. So, with the provoked heavy metal testing that we talked about, this violates a lot of these ethical implications because you have a high amount of people now that are getting unnecessary treatment, unnecessary chelation. They're getting false positive results, incorrect diagnoses, and they're paying for this test and paying for the chelation therapy from a practitioner that should not be doing it in the first place. So be very careful. Not all tests are created equal. Not all tests are worth doing. If you have symptoms and you think, let's say you go to the internet and you say, I have these symptoms and I reasonably want to know what's causing them. I want to know what can make me better. Go to a healthcare professional that is licensed to treat those conditions. Don't go to a naturopath. Find out what tests they're using. You can, even being a layperson, you can go to the internet and find out what is the sensitivity and specificity of some tests. Like, ask your doctor questions. It's okay. Ask them, this test that you want to give me, what's the validity of this test? What is the usefulness of this test? Before I consent to doing this test, can you tell me the risks involved? Can you tell me how this is going to change your management? And they should be able to tell you. I'd be happy to answer those questions. And granted, yeah, an expert is going to be an expert on the subject, but they should be willing to answer those questions for you. And I think having that back and forth dialogue with your clinician is important. I think you are definitely should be allowed to ask about those important questions about validity, about the test, about how it's going to change the therapy, and talk about your goals for treatment. Even because even if a therapy might be useful, even if it might change the management, um, and you don't want that kind of therapy, then it might not be worth doing the test because you already did not consent to the therapy that they want to do. So the test might not even be useful at that point. So um, I know that was a little bit of a tangent, but this is why it's important to understand stats. It's why it's important to understand what these tests exactly do, how these pseudoscientists are using testing to promote false therapies, how they're using these fake boards to convince the public that they know what they're talking about. And kind of the biggest takeaway is I agree that, and the WHO agrees as well. I think the CDC also agrees that we should strive to reduce the amount of heavy metals in things like dental fillings. Like, if we can do something better than that, like, while it might not be problematic, it still might be better to reduce that baseline level of exposure at all. So now that we have some different alternatives to the amalgam fillings, sure, it's worthwhile to head in that direction of improving our therapies. And I'm all for that. But it's not worth the panic. Uh, it's not worth freaking out if you have amalgam fillings. It probably isn't worth you finding some expensive biological dentist to remove all your fillings and replace them, unless that is something you want to do maybe for cosmesis. That might be that's a reason why you might want to switch. But I think as we're heading in this direction anyway, it's kind of pointless to live in this paranoid state of opposing levels of heavy metal that we know really aren't causing a problem. So this conversation is much more nuanced than a lot of these practitioners will grant it. And that's why I do this show. That's why we're here every week talking about it. So thank you, everybody, for sticking around. I'm not sure what next week's topic is going to be. I have to plan that out because I'm trying to get a few guests lined up in the near future. So we'll see what happens with that. As for the rest of this week, it's a big show weekend. And the reason why I did my show earlier than usual is because I'm going to be on Skeptic Haven this afternoon talking about gender roles. So I'm actually going to find the link for that. I'll put it in the side chat. So join us in a little over an hour. I'm talking with Heathen Queen about gender roles, so come stop by over there. It's going to be a great time. Also, tomorrow I'm going to be on Talk Heathen with Katie Montgomery. And then after that, I have Nat One Heroes playing Rime of the Frost Maiden, Dungeons and Dragons. And then on Thursday, this upcoming week, I'm going to be on Transatlantic, I think with Katie Montgomery, but I'm not sure. I could be wrong. But I will be on Transatlantic. And then on Friday, I'm going to be on Truth Wanted. So it is a very busy week. We're going to have a great time. No after show today because of the Skeptic Haven show. So I hope that you all will join me over there instead. And I'm a little sad we're not going to do the after show, but we will next week. Next week, we will have the after show. And that is for the patrons, channel members, and Twitch subscribers. So if you're one of those people, next week you can join us. Probably, I think we're going to continue our Reiki class that we were doing. And to finish it off, we're going to shout out the patrons. We have Regios, Jody L, Pharmacy Sabrina, Ellipsis, Tons of Mice, and a new patron, Steve Ferris, Haney Ball, and SG. Thank you for your support. I could not do this without all of you. And we also have our lovely channel members, Rebus Wind and Lilypad LA. Thank you for your support. I greatly appreciate it. So no after show today, but I hope to see you all later, and we'll see you all in the next one. Bye, everyone.